today we're going to review the second part of the introduction to pharmacology, and this will mostly deal with pharmacokinetics and different types of medication administration routes and solutions. So first, let's start with pharmacokinetics. And what is that? Pharmacokinetics is the study of the basic processes that determine the duration and intensity of a medication's effect. The four processes of pharmacokinetics are absorption, distribution, biotransformation, and elimination. So what is absorption? Well, absorption is the medication is absorbed into the circulatory system, and then the drug has to find its way to the site of action. Distribution is how the medication is distributed throughout the body. But then it goes through biotransformation, which is the breaking down or metabolizing of the drug into its active form if required, and finally all drugs must be eliminated, and that's where they're eventually excreted from the body. Now, every role does not necessarily play in the action with pre-hospital medications that we use, but overall we must have a fundamental understanding of these. So when we're thinking about that, we have to think about the ways in which drugs are designed and administered. So we have two main categories of drug administration, and that is enteral and parenteral routes. So if we think about it, enteral is medications that are administered and absorbed through the GI tract. So this includes our oral medications, our orogastric and nasogastric via tubes administration, sublinguals, which is underneath the tongue, buccal administrations, which is between the cheek and the gum, and the absorption rate for that is very similar to a sublingual. And then rectal administration, which can have both local and systemic effects. Now, as I said in class today, the rectal route is frequently used in pediatrics or for those who cannot swallow oral medications. Your parenteral routes are any medications that are delivered in a method besides through the GI tract. So we've got our topical, which is placed on the skin, intravenous, which is the main route that medications are administered in the pre-hospital setting, endotracheal, which is to be delivered down an endotracheal tube, interosseous, umbilical, which is reserved for newborns and is not very commonly used in the pre-hospital setting, intramuscular, subcutaneous, inhalation, and topical. And also, let me add intranasal into that. It's a newly popular route. It's been in place for the last few years in the pre-hospital setting. The medication is aerosolized and instilled into the nose, and therefore it is rapidly absorbed through the vascular network in the nasal tissues. And it's really a very preferable route, especially if we're considering an intranasal or a rectal administration. So examples of our enterals is oral, like I said before, orogastric, and sublinguals. Buccal, between the cheek and the gum, and like I said, it's similar to sublingual. And then the rectal is reserved for unconscious or vomiting patients. Parenteral are IVs preferred. UT is alternate. IO is another alternative use and is quickly gaining in frequency and popularity. Umbilical are for newborns. Intramuscular. Most medications can be administered IM. They do have a slower absorption rate than IV administration. And then subcutaneous is even slower than an IM administration. So in the pre-hospital setting, we mainly do IM and IVs, and definitely IVs more than others. We also have inhalations, so think about medications such as albuterol or anything used in the nebulizer. And then, like I said, our topical. Most medications is given IV. It's a very popular route, it's a rapid route, and it's a very predictable route. But it is not without danger. It is also the route that has the most potential for causing adverse reactions. Now, how are drugs prepared? They're in different forms. We have solid forms and liquid forms. So our solid forms are pills, powders, tablets, suppositories, and so on. And then our liquids are solutions, tinctures, suspensions, emulsions, spirits, elixirs, and syrups, and so on. Pills are to be swallowed. Powders are not as popular as they once were, but they're still made. Tablets, pressed powder into a disc-like form to be swallowed. Suppositories are mixed with a wax-like base, and they're inserted and they melt at body temperature, and then the drug is absorbed. Capsules are gelatin containers filled with tiny powders or pills, and they are to be taken in their original form, typically not to be broken. Some medications you see, some tablets and pills you see will be scored, and those are ones that are designed to be cut if needed for a partial administration. Solutions are water or oil-based. Tinctures are prepared using an alcohol extraction process. Suspensions, the solid does not dissolve in the solvent, and then emulsions are suspensions with an oily substance in the solvent. Spirits are solution of a drug in alcohol. Elixirs are alcohol and water solvent that often have flavoring, and then syrups are sugar, water, and drug solutions. So how do drugs act? Well, drugs act by binding to receptor sites, changing physical properties, chemically combine with other substances, and altering normal metabolic pathways. So how does this body, or humans, how do we respond to drug absorption? Well, we have different things that can happen. Some are expected and some are not expected. The biggest thing is we want to see a positive therapeutic effect, but we do not always see that. So side effect is an unintended response to a drug. An allergic reaction is when a hypersensitivity develops to that drug. So once the hypersensitivity develops, it can keep on increasing in reaction level. And at that point, that person is basically considered to be allergic, so they do not want to administer that again. Idiosyncrasy is the drug effect is unique to an individual. So not the general population doesn't have that effect, but that individual does have that experience. Tolerance, decreased response to the same amount. And like I said in class, a lot of times think about, for example, ones who are receiving narcotics. A lot of times they have to have a larger dose in order to get the same effect. Cross tolerance is tolerance for a drug develops after administration of a different drug, and then we also have rapidly occurring tolerance to a drug or tachyphylaxis. Cumulative, increased effectiveness when a drug is given in several doses, so as the dosages are given, then we have it increasing. And then drug dependence is the body physiologically responds and becomes dependent on it. Interaction is one drug will alter the response of another drug, and then antagonism is one drug that blocks the response of another drug. So think about something such as Narcan that blocks the response to narcotic or opiate medication. Summation is where we have it's an additive effect. So we give two medications and they combine together to give the same effect. So it's like 1 + 1 = 2. So we get the two together and we both get the same effect. Where synergy is a little bit more than that. We're giving the two medications together, but they produce a greater response than the sum of their individual medications. So Where maybe we're given 2 pain relievers, the 2 together produce an even greater response to pain relief. Potentiate is one drug enhances the effects of another, and interference is where at the biochemical level the drug will pharmacologically affect the other drug. So what factors do plays into a drug response is we're going to look at a person's age, especially I think of pediatrics and geriatrics. A lot of times we may have to change the medication dose and maybe rate of delivery and frequency of delivery. Body mass, a lot of our medications are weight-based, so body mass will definitely make an impact on that. Gender, environment, nutritional status, movement status, whether you have sedentary lifestyles, things like that can affect your environment. The time of administration, did you give the right amount of time in between, or you give it too frequently or not frequently enough? Any type of other pathological disorders, for example, if we give a drug that has a lot of liver clearance and we have someone who's in hepatic failure, we may not clear that drug as well. Or the same thing goes for somebody who has a renal clearance medication that they're taking and they have renal failure. Genetics and then psychology. What are drug interactions? Is when 2 or more drugs are available in the same patient and the interaction occurs. And it can be a positive effect, a negative effect, or really have no effect on the actions. So to summarize, we kind of went over like drug names, sources, classifications over the last couple of lectures, the Food and Drug Administration, administrating of drugs, and properties of drugs. A couple other things we want to throw in there is a little bit more of terminology, is half-life. Half-life is the time required for a level of medication in the blood to be reduced by 50% of its beginning level. So that's a kind of an elimination question. As we look and we say, okay, what's the half-life of the medication? If its half-life is 2 minutes, we know we'll need to do frequent re-administration because that drug's only going to really be effective for a couple minutes. But if its half-life is 6 or 8 hours, then we know we may most likely be doing really only one administration because it will stay active in the system for a long time. We also have loading doses, and loading doses are really these large initial doses. So we may have a drug that we give a loading dose and then follow that up with a maintenance dose or smaller doses. So maintenance doses maintain therapeutic blood concentrations, and loading doses produce a therapeutic level of blood concentration. Onset is when the action onsets, and that's the pharmacokinetics of the medication. When does it peak in concentration, and how long does the action duration occur for? So we may have a medication that onsets in 2 to 4 minutes. It peaks in 15, and its duration can be like 20 minutes. So that's something that's good for us to know because we need to know how often we may have to remedicate a patient. That will conclude today's part 2 for the introduction to pharmacology. And then if you will move on to the PowerPoint production that involves medical abbreviations, and go through those and make sure that you're familiar with each abbreviation.